Hi guys, how are you all? And today's live is about stroke, the causes, symptoms, and the treatment. Okay, it's about stroke. So stroke is two types: ischemic stroke and hemorrhagic stroke. Ischemic stroke means it's due to blockage, and hemorrhagic stroke is due to bleeding. So if a person have a stroke, then please do act fast and save a life. A stroke occurs when blood flow to the part of the brain is blocked or a blood vessel in the brain burst. Okay. Yes, yes, guys, this is about the stroke. Today's live is about the stroke. And if you're not to my channel, please do subscribe my channel and like my live also. Hope you all like my live. Hi guys, the live is about stroke and the symptoms of stroke: sudden severe headache, nausea or vomiting, dizziness or loss of balance, blurred or lost vision, and weakness or numbness in the face, arm or leg, mainly one side. Chances more for one side, and confusion or trouble speaking or understanding, and difficulty in walking, sudden fatigue, feels very tired. And the causes of stroke is high blood pressure, diabetes, high cholesterol, smoking, obesity, that means overweight, sedentary lifestyle, if you're taking many junk foods, that is mean, and had heart diseases and excessive alcohol use is all the causes of stroke. And the signs, remember the fast. Okay, fast means first face. In face will be drooping on one side, and ask the person to smile, and they can't smile properly, then it will be due to stroke, or the face is drooping. And second is the sinus arm. Look at their arm. They have an arm weakness, and ask the persons to raise both arms, but they can't raise properly. So it will be also a sign of stroke. And about the speech, S is about speech, and they will have a difficulty in speech, and ask the person to repeat a simple sentence, they can't do because of the face drooping. The lips will be on the one side, and so they can't properly speak. Okay. And the T is about time. It's a very life threatening condition, so uh, take the person to the hospital as soon as possible. And guys, if you're new to my channel, please do subscribe my channel and like my live also. And I will be uploading about the medical details and lives and games and everything. Yeah, come on guys, it's all about stroke. Hello, hi Stinky Donkey, hi. Yes, hi dear, how are you? And if you're new to my channel, please do subscribe my channel and like my live also. And yes, it's the live is about stroke. And nowadays many persons have stroke. Good, okay, nice, nice. You're from which country, dear? Yes, guys, it's about stroke. And the stroke is mainly due to when blood flow to the part of brain is blocked or a blood vessel ruptures or burst. Okay, this is how the stroke is happening. And please read everything, guys, because it's all about your information, because nowadays many are suffering from stroke. And about the prevention, always control blood pressure and control diabetes and maintain healthy weight, because overweight also can cause stroke. And eat healthy foods and exercise regularly, quit smoking and manage stress and sleep well. Yes, guys, and if you're new to my channel, please do subscribe my channel and like my live also. The about the treatment, the acute treatment, that means the sudden treatment will be for ischemic stroke. Ischemic stroke means due to the blockage of blood flow. That is ischemic stroke. Hi, Manuel. Well, yes. I don't know your language, dear. Sorry. Can you please write it in English? Yes, guys, it's about stroke. Gunjan. Hi, guys, and if you're new to my channel, please do subscribe my channel and like my live also. Actually, stroke is a medical emergency that happens when blood flow to the part of brain stops, causing brain cells to die. Okay, there is two types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke means blocked blood vessels, and hemorrhagic stroke is due to burst blood vessel. Okay, and signs and symptoms, it's fast. Okay, fast mean F means face drooping, A means arm weakness, S means speech difficulty, and T means time to call emergency services. Because if a person's having stroke, this will be the signs. So please to remember always, because if a person's having a stroke, you can understand the person is having stroke by these signs. Okay. And about face drooping, the one side of the face droops or is numb. And about arm weakness, one arm is weak or numb. If the person try to raise both hand, one drift down. They can't raise the hand. Okay. And speech difficulty means speech will be slurred or hard to understand, or the person cannot speak. And and if you see any signs of these, and it they need a medical emergency, medical help. Okay. Hi guys, if you are not to my channel, please do subscribe my channel and like my live also. Today's live is about stroke. Okay, and there is a transient ischemic attack, that is TIA. It's also called mini stroke, and it's a temporary blockage where symptoms last a short time but still require an urgent care. Okay, the key risk factors are high blood pressure and lifestyle habit like smoking, lack of exercise, and poor diet. It may cause stroke, and health conditions like diabetes, high cholesterol, obesity means overweight. This is also can cause stroke. Hi guys. Stroke is a medical emergency and it's crucial to get medical treatment right away, okay? Because getting emergency medical help quickly can reduce brain damage and other stroke complications. The symptoms includes trouble speaking and understanding what others are saying, because a person having a stroke may be confused, slur words, or may not be able to understand speech. Okay, and other symptoms will be numbness, weakness, or paralysis in the face, arm, or leg. This often affect just one side of the body. The person can try to raise both arms over the head. If one arm begins to fail, it may be a sign of stroke. Okay, and also one side of the mouth may droop when try to smile. And another symptom will be problem seeing in one's or both eyes. The person may suddenly have a blurred or blackened vision in one or both eyes, or the person may see double vision. They also feel double vision. Okay, and there will be a headache, and a sudden severe headache may be a symptom of a stroke. Vomiting, dizziness, and a change in consciousness may occur with the headache. Okay, and trouble in walking. Someone having a stroke may stumble or lose balance or coordination. And when to see a doctor? For that, think fast. F means face, A means arms, S means speech, and T means time. Okay, face, ask the person to smile. Then if one side of the face is drooping, they need urgent care. And ask the person to raise both arms, one arm drift downward or one arm unable to raise, then there's a stroke chance. And about speech, ask the person to repeat a simple phrase. If the person is a person's speech slurred or different from usual, then it will be also a sign of stroke. And if the three things are there, then get the person to the hospital as soon as possible. The causes of stroke is high blood pressure that's not under control, and over treatment with blood thinners, also known as anticoagulants, and bulges at weak spots in blood vessel, that is aneurysms, and head trauma such as from a car accident, and protein deposit in blood vessel walls lead to weakness in the vessel wall. This is known as cerebral amyloid angiopathy. Medical risk factors of stroke are high blood pressure, smoking, and high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease like heart failure, heart defects, heart infection, irregular heart rhythm, that is atrial fibrillation, and personal family history of stroke, heart attack, or transient ischemic attack. And about age 55 or older have a higher risk of stroke than younger people. Hi guys, if you are new to my channel, please to subscribe my channel and like my live also. And these are all about the stroke symptoms, causes, and about treatment and everything. And the complications of stroke. A stroke can sometimes cause temporary or permanent disabilities. Okay, complication depend on how long the brain lacks blood flow and which part is affected. Complications are loss of muscle movement, that is paralysis. The person become paralyzed on one side of the body or may lose control of certain muscles such as those on one side of the face or one arm, and trouble talking or swallowing. A stroke might affect the muscles in the mouth and throat. This can make it hard to talk, rarely swallow or eat, and also may have trouble with language, including speaking or understanding speech or reading or writing, and memory loss or trouble thinking. Many pupils who had stroke experience a memory loss, and other may have trouble thinking, reasoning, making judgment, and understanding concept also. And some may have emotional symptoms like trouble controlling their emotions. They may develop depression, and other complication is pain, numbness, or other feelings may occur in the parts of body affected by stroke. If a stroke causes you lose feeling in the left arm, you may also develop tingling sensation in the arm, and change in behavior or self care, that is also common. And the prevention of stroke is by control high blood pressure known as hypertension, and lower the amount of cholesterol, quit tobacco use, manage diabetes, maintain a healthy weight, eat a diet rich in food and vegetable, exercise regularly, and drink alcohol in moderation if at all. Treat obstructive sleep apnea, and this all about stroke guys, and please read everything. Hi guys. Luna. Okay. Yes guys. The live is about stroke, and the causes are high blood pressure, diabetes, high cholesterol, smoking, obesity, and sedentary lifestyle, heart diseases, excessive alcohol use, and symptoms include sudden severe headache, nausea or vomiting, dizziness or loss of balance, blurred or lost vision, and weakness or numbness in the face, arms or leg, one side, and confusion or trouble speaking or understanding, difficulty in walking, and sudden fatigue. That means sudden tired feel. Okay, and if you're new to my channel, please do subscribe my channel and like my live also, guys. The long-term management and recovery about the stroke is regular medicine to control BP, diabetes, and cholesterol, and healthy diet, regular exercise, weight management, and smoking and limit alcohol, and physiotherapy, speech therapy, and rehabilitation. Okay. Yes, guys. This is about stroke. Hi, guys. It's about stroke. Stroke is an emergency condition. Okay. And please read everything so that you can understand the issues and everything. And about the stroke, the signs to remember is face fast. It's fast. Please try to remember this because this is the signs you have to remember. That is how you can understand the person is having stroke or not. Okay. And face, arms, speech, and time. This is the signs. The fast means face, arm, speech, and time. In face drooping on one side, and in arm weakness, and speech difficulty, and T is time to call emergency services immediately. Hi guys, and about the golden hour is the first 60 minutes after symptoms begin. This is the golden hour of stroke. If a person is having the signs that is face drooping on one side, arm weakness, speech difficulty, and other symptoms of stroke, then it's crucial to get them into the hospital within first 60 minutes. Okay, so in that minute, they can save brain cells and prevent lifelong disability. Okay, and the first 60 minutes is the golden hour of stroke. If a person is having a stroke, the first 60 minutes after symptoms begin, during which rapid medical treatment can save brain cells and prevent lifelong disability. Okay, and why the first hour matters. Fast cell death, that is nearly 1.9 million brain cells die for every minute a stroke goes untreated. Okay, and for better recovery, the first hour matters. That help restoring the blood flow within this window give highest chance of a full recovery. And time limits. Clot busting drugs work right away, though they can sometimes be given in 4.25 hours, and clot removal procedures can happen later in the specific cases. And how to spot a stroke. Let me tell you how to spot a stroke. Be fast. Okay, B means balance. Sudden loss of balance or trouble walking. E means eyes. Sudden vision changes or trouble seeing. F means face. One side of the face droops or looks uneven. A means arms. One arm feels weak or numb. S means speech, slurred speech or trouble speaking. T means time, call emergency service right away. So be fast is the how to spot a stroke. B means balance, E means eyes, F means face, A means arms, S means speech, and T means time. And if you're new to my channel, please do subscribe my channel and like my live also, dears. The live is about stroke, guys. Hi, guys. So stroke occurs when blood flow to part of brain is blocked or blood vessel in the brain burst or rupture. Okay. The stroke is a medical emergency that occurs when blood flow to part of brain is blocked or reduced. So every minute counts when it comes to stroke treatment because a swift action can mean the difference between recovery and long-term disability or even death. The golden hour refers to the critical first 60 minutes after stroke symptom to begin, during which treatment is most effective. Okay. So what is stroke? A stroke happens when blood supply to the part of brain is interrupted or reduced and depriving brain tissue of oxygen and nutrients. This can cause brain cells to die within minutes. Two types of strokes are there: ischemic stroke and hemorrhagic stroke. Ischemic stroke means it's caused by a blocked blood vessel in the brain, and about hemorrhagic shock, it's caused by bleeding in or around the brain. These are the two types of strokes. Okay. And the consequence or complications of a stroke is paralysis or weakness on one side of the body, difficulty speaking or understanding speech, vision problems, memory loss, emotional change. These are the complications. And why the golden hour is critical? The first 60 minutes is the golden hour of stroke. Okay. And the first 60 minutes after stroke symptoms begin, during which treatment is more effective. Okay. However, the window for effective treatment can extend up to 4.5 hours for some patients. But the golden time is first 60 minutes, the first 1 hour. And why every minute counts during a stroke? During a stroke, brain cells die rapidly. Estimated that 1.9 million neurons die every minute a stroke goes untreated. This is why immediate action is crucial. Faster treatment leads to better outcome and chance of survival increases. The risk of long-term disability decreases. More treatment options are available. The fast method is the recognition of stroke symptoms. Okay, fast. In the fast, F means face. Ask the person to smile. touch one side of the face droop, then that's the sign of stroke. And arms, ask the person to raise both arms and does one arm drop downwards, that is also the sign of stroke. And about speech, ask the persons to repeat a simple phrase. Is their speech slurred or strange, that is also the sign of stroke. And if you observe any of these signs, and call emergency services immediately. And the symptoms of stroke are sudden severe headache, nausea or vomiting, dizziness or loss of balance, blurred or lost vision, weakness or numbness in the face, arms or leg, confusion or trouble speaking or understanding, difficulty in walking, and sudden fatigue. These are the symptoms of stroke. Stroke is an emergency condition and golden hour is first 60 minutes until 4.5. Some persons can. Hi guys, and if you are new to my channel, please to subscribe my channel and like my live also. This about stroke. Please read everything so that you can understand how the stroke is happening. And hi guys. Hi guys. The live is about stroke. Please read everything so that you can understand about stroke. It's an emergency situation. Okay. Hello guys. Read everything. These are the symptoms: sudden headache, nausea or vomiting, dizziness or balance, loss of balance, blurred or lost vision, weakness or numbness in the face, arm or leg one side, confusion or trouble speaking or understanding, difficulty in walking, sudden fatigue. These are the symptoms of stroke. And if you are new to my channel, please do subscribe my channel and like my live also. Hi guys.